A member of our community this week asked a question that got a lot of views in one day. And she wanted to know if the feelings she was having, the ones that come with months and years of pain, dismissal, and loss, were something other Sjogren's patients experience too. And the research says yes. And it says her doctor should have asked first. Hi, my name is Dr. Kara Wada. I am a quadruple board certified allergy, immunology, lifestyle medicine physician. I also live with Sjogren's disease and dysautonomia. And so when I say I understand what it feels like to have a disease that changes everything about how you move through the world, I mean that. Today, I want to talk about something that doesn't get discussed nearly enough in doctors' offices, and I would guess rheumatology and immunology offices or on YouTube. And it's the mental health toll of living with Sjogren's disease and what the research shows, why it happens biologically, and what can actually help. If you're watching this and today is a hard day, I'm glad you're here. Save this, maybe squirrel it away. I also want you to know right now that 988, you dial it, you text it, you could access that resource at any time. And I will say that again, but I want you to have that right now because sometimes when we talk about these challenging, painful, hurtful feelings, it can bring things up. So if you need to hit pause, save this for another day, or just stop watching it and reach out to 988. That resource is there for you if you are feeling like you need to talk with someone because this is hard stuff. I also always have to say that this isn't made for medical advice, right? We aren't having this one-on-one conversation. This is for educational purposes only, and it's really important that you work closely with your personal healthcare team and your clinicians. Before I share any research, I want to say something directly to you. If you have ever had a moment or a season or longer where Sjogren's has felt like too much, where the pain, the exhaustion, the dismissals, and the losses added up to something much heavier than you knew how to carry, where you wondered if it was always going to feel this hard, that experience is very real. It's documented and it is not a character flaw. Living with Sjogren's disease means living with a condition that is pretty invisible to most people around you. It can mean losing things, your energy, your identity, sometimes your career, your relationships, your sense of who you were before the diagnosis or before the symptoms that maybe eventually resulted in a diagnosis came about. For 30 to 40% of people means being told your labs are normal while your body tells you otherwise. And it means explaining yourself over and over again to folks who just don't quite understand. That is an enormous amount to carry. And most of the medical system doesn't have the bandwidth for it. The medical system is created and gets the results it gets because of how it is set up. It is set up for quick and easy problems that frankly generate quick and fairly easy revenue. So when we live with complex, chronic, multi-system conditions that don't fit neatly in a box, they don't fit neatly in a 10 to 15, or even sometimes, if we're lucky, a 60-minute appointment. If today feels like one of those days where it feels like too much, 988 is there. Call or text anytime, any day. You don't have to be in crisis to reach out. You just have to need someone to talk to, and you're not alone in this room. Now let's talk a little bit about why this is happening and the biology behind this, because understanding the biology, I think, changes a lot about how we relate to what we're feeling. Depression and Sjogren's disease are not two separate problems that happen to exist in the same body. I mean, they kind of are. But they're also connected at the immune system level and the neurologic level. The same inflammatory processes that drive the disease, immune dysregulation, cytokine, they also affect our brain. Neuroinflammation, disrupted sleep architecture from pain and being woken up from dryness. The physical and the cognitive exhaustion of a body running a chronic immune response. These aren't side effects of being sad about being sick. These are biologic pathways where the immune system directly affects brain chemistry and mood regulation. The research is pretty clear too, and it needs to be said plainly. Women with Sjogren's disease carry a significantly elevated risk of depression and suicide compared to the general population. A 2025 study found that in the first year after diagnosis, It's the highest risk window. Maybe not because the disease is necessarily its worst then, but let's think about it. That's when our identity shift is the sharpest. It's when the losses are the newest. It's also when the medical system has maybe confirmed what's wrong, but hasn't yet really helped you figure out how to live with it and how to help get those symptoms under better control. Again, this isn't your fault. This is documented biological and psychological reality of this disease. It deserves to be a part of your care rather than an afterthought and not something you bring up only if it gets bad enough. So I want to talk a little bit about why that first year might be the hardest, a little more about that. Because if you're newly diagnosed or you're on this diagnostic odyssey, I want you to hear this directly. That period immediately after diagnosis is hard in a way that's different from what comes before and different from what comes after. Before a diagnosis, often we're fighting to be believed. It takes an enormous amount of energy and it produces its own kind of damage. The self-doubt, the medical gaslighting, the years of being told it was stress or anxiety, perimenopause, something you were imagining. After the diagnosis, there's often relief. I remember that feeling. It was relief with a tinge of guilt and oh gosh, all this mess of feelings, mess of icky feelings. And then sometimes quickly thereafter, after that relief, it's like relief and grief because now you have a name. That name confirms that this is real. It's not going away and your life is going to look different than you thought it would. And that grief is appropriate. It deserves space. And most medical appointments aren't designed to give it much or any. If you were in that first year and even thereafter, be gentle with yourself. What you were feeling makes biologic and psychologic sense. And also just because it makes sense doesn't help us get through it any quicker or any easier. It also doesn't mean it stays this way. It means that you're at the beginning of learning how to live with something that most people around you will never fully understand. It's really hard and you're in it, you're doing it. So what actually helps? All right, let's talk about that because this section matters as much as everything before it. The first is therapy and specifically finding a therapist who understands chronic illness. Not every therapist does, and finding one who does is worth the search. Psychology Today, which is a great resource to look and connect with therapists, has a filter for chronic illness specifically. The Arthritis Foundation and the Sjogren's Foundations also both have resources for finding mental health support. And it may take more than one try to find someone who is a good fit. That is pretty common. It's just trying to date someone or to find a new friend, right? You need to find someone that you align with and you work well with. And that sometimes doesn't happen. You don't always meet your sweetheart on the first try, right? The second is integrated care. Mental health screening should be a part of your immune system care. And the research is pretty explicit to say that we should be thinking about this routinely, not just when a patient brings it up. And it's actually been this post coming up in our Facebook community and delving into this research that we're making some changes in how our clinic is set up to be more proactive about this. Because this is a gap that I would have to guess is happening in most places. And you can say this at your appointment. Hey, I've read that depression and mental health challenges are a lot more common in Sjogren's patients. I'd like to talk about this as part of my ongoing care. Can we talk about what this might look like? Do you have any therapists that you have had patients connect with that are worth recommending? Do you have any other local resources or regional resources that would be helpful for me to know? I think this is harder sometimes for us to bring up. I say us from the patient side and maybe the clinician side too, if you have a very thoughtful clinician, because the reality is for so many of us, many of our physical and other symptoms as well, invisible symptom load, often are blamed on our mental health, right? And I worry sometimes about bringing up the topic because frankly, I don't want people to think I'm going to gaslight them again and say, hey, I think all your pain and your sleep issues and everything are related to your depression, right? Because that would come off real bad. But I do think, gosh, if I had a patient who kind of started that conversation, that would at least give me a little bit of an open door to go, oh, yes, let's talk. Feel much more comfortable with it. The reality is we're humans too as physicians, and sometimes we do feel uncomfortable talking about these difficult, challenging things. And that's magnified in rushed visits. We don't like the rushed visits either. That's actually why I changed how my practice is set up because I couldn't function in that anymore. The third is community. And I don't say this lightly. The research documents peer support as a genuine positive factor. What happened in our Facebook group this week, the way our community showed up for one of our members when she asked that hard question, that's not just kindness, that is medicine. And being known and seen and heard by people who understand what you live with is protective in a way that is measurable. It is important though to find your group, to find your tribe, because there are some places and spaces that you may not feel are a right fit, or maybe don't have the energy or the vibe, or however you want to describe it, that just don't feel like home. And so it is important to find a group and to find that support. And for some people that may be a group, for some people it may be one or two people. The fourth is hope for the disease itself. I want you to know that the research is moving. Ianalumab, which is the medication that Novartis has under clinical trial in phase 3 clinical trials, and nipocalimab, which is Johnson & Johnson's medication, have both received FDA breakthrough therapy designation for Sjogren's disease. There was a recent call that Novartis had. Of course, they have these earnings calls. They had their Q1 earning call. And it also was, things are moving in the right direction. And so our hope is that by the end of this year, that we will finally have our first FDA-approved treatment for Sjogren's disease. And what's really exciting, the imagist scientist in me is seeing that of these multiple medications, those are just two. There's 3 or 4 other medications that are in advanced stages of clinical trials too. They all have different mechanisms in how they work. So in my mind, gosh, as I nerd out about the science, that gives us multiple ways we can intervene on this immune system that is not quite following the textbook. And so perhaps if one medication doesn't get the desired effect, then our hope is another one will. Because although Sjogren's looks and sounds similar in a lot of folks, what we're coming to find out is that it's actually multiple kind of subgroups of folks. Each of those groups has a little bit different picture. I also want to mention that we are getting ready to host in July the 5th annual virtual Sjogren Summit. It will include conversations around mental health, self-management, updates on the clinical trials and treatments, and updates on standard of care treatments, and what living and ideally thriving with Sjogren's can look like in the real world, not just the clinical picture, but the full human picture. It is free to attend live, and we leave the recordings up and free for a couple weeks afterwards. We want you to be a part of that conversation. The waitlist is in the description below. We'll also include a link for our free Facebook group that is a moderated community. And before I send it anywhere, I want you just to sit here with me for a moment. If you watched this video because you needed to, if you've been carrying something heavy and you didn't know if anyone else understood, I want you to know that what you're feeling has a name. It has a biologic explanation. It's been documented by researchers who took it serious enough to study it. You are not weak for struggling with this. You're not dramatic. You are not a burden. You are a real human being with a systemic, complex, poorly understood disease that affects your brain and your body and your identity. And you are doing that without nearly enough support from the medical system that's supposed to help you, right? That's not your failure. That's a system failure. And you deserve care that sees the whole picture, not just the antibody levels or the dryness scores, but you. How you're sleeping, how you're coping, whether you have anyone in your corner that actually understands. You deserve that. So please don't give up and keep looking until you find it. If today is one of those hard days, 988, call or text anytime, 24/7. You do not have to be at the edge to reach out. You just have to need someone to talk to. That's enough. Save this video, send it to someone you're worried about. Send it to someone who has Sjogren's but has never had a doctor ask how they're really doing. And if this channel is a place where you feel less alone, maybe hit subscribe. That's exactly what it's here for. We have new videos every week. And until next time, please take care.